Please start.
Yes, sir. Namaskar. I welcome you all. Let's begin with our session today. Good afternoon to all the respective dignitaries, esteemed researchers, scholars, presenters, and participants joining us from across India and abroad. On behalf of Writers Reservoir, a think tank of communicators and communication today, a quarterly bilingual media journal, I warmly welcome you all to the technical session 4 of our 2-day international conference on global issues and media response. Today, we are beginning a very important and interesting session on public health pandemic and the power of media. This session brings together researchers and experts who will share their knowledge about how media plays role in public health and pandemics. We are very happy to have Bhanavat sir with us today. His guidance and support have been very valuable for this conference. We thank him for always encouraging academic work and research. Thank you very much, sir. We are also honored to welcome our session chair, Dr. Sheel Nidhi Tripathi, Professor, BA Bharati Vidyapeeth, Institute of Computer Application and Management, New Delhi. A proud honor of two patents in the field of journalism and mass communication, Dr. Sheel Nidhi Tripathi is distinguished academician and a well-known name in the discipline. A gold medalist from Lucknow University and NET qualified. Dr. Sheel brings more than 2 decades of academic and professional experience, having served at esteemed institutions such as Lucknow University, Unison University, IMS Dehradun, IIM Ahmedabad, GJUSNT ISAR, Technia Institute, and Bharati Vidyapeeth. Her core areas of expertise include development communication, media research, corporate communication, print journalism, public relation, and advertising. She has conducted numerous workshops and training programs on personality development and communication skills from Haryana High Education Board, GJUSNT, various polytechnics colleges and schools. Dr. Sheel has several publications in Scopus Index and reputed journals focusing on areas such as digital media, development communication, and storytelling. She has also contributed to various government-funded projects, including ICSSR India sponsored seminar and conferences. Ma'am, I welcome you on behalf of the whole organizing team and present you a symbolic e-bouquet expressing our gratitude for participation and intellectual contribution to this conference. We are honored to have you guide this session.
Thank you. Thank you very much. Very good afternoon to Sanjeev Panavat sir and all the presenters and the esteemed guests present in this session. And thank you very much.
With a great respect, I now hand over the session to our session chair to take the proceeding forward. Over to you, ma'am.
So I would again like to thank you for the warm welcome and the detailed information. It always feels good when you hear good about yourself. So it's all because of Sanjeev Bhanavat sir, my professor, mentor, guide, and the most important is my friend who has always there wherever I needed any consultancy in the field of journalism. So thank you very, very much, sir. And I could see Bala Lakhendra sir also there. Sir, namaskar. बहुत अच्छा लग रहा है आपसे मिलके. डॉक्टर हरि कृष्ण जी भी दिख रहा है मुझे. गुड आफ्टरनून सर. And very good afternoon to all the paper presenters over here. And the topic of this session is very important and relevant, that it is public health, pandemics, and the power of media. So when it comes to the power of media, I was attending the morning panel discussion also, where we were talking about AI, but before that, Sanjeev Bhanavat sir and the other esteemed dignitaries presented their views and told us कि कलम में कितनी ताकत होती है और मीडिया एक वो स्तंभ है जिसने हमें हर हर फेज में स्तंभ की तरह ही काम किया है, खड़ा रखा है। एक अगर स्तंभ हिल जाए तो सारी बिल्डिंग डगमगा जाती है। तो उस तरीके से अगर मीडिया को हम एज अ पिलर नॉट ओनली फॉर डेमोक्रेसी बट फॉर ऑल दी structures we see, and we find that it has been very important and very useful. And therefore, when it comes to pandemic or public health, again I would say that this COVID-19 taught us that accurate narratives saves lives while misinformation causes them. तो कितना misinformation था और मीडिया ने किस तरीके से उस पेंडेमिक के दौरान काम किया, या अभी भी when it comes to public health मीडिया कैसे काम कर रहा है, AI उसमें कैसे हमारे साथ हम उसका यूटिलाइजेशन कर सकते हैं. How many organizations are with us? How many media professionals are with us, training us, giving us media literacy, and how are we coming out of this pandemic? Because information से ज़्यादा pandemic में हमने देखा वायरस तेजी से फैल रहा है और उस वायरस के साथ मीडिया भी लगातार काम कर रहा था. So first is obviously the doctors, the medical people who served us, but we must appreciate the efforts of media जिन्होंने हमें मिस इन्फॉर्मेशन या डिसइन्फॉर्मेशन या ऐसे हालातों के बीच में भी मोटिवेटेड रखा. तो बहुत अच्छा टॉपिक है इस सेशन का, एंड आई एम रियली वेरी ब्लेस्ड एंड हैप्पी टू हैव चेयरिंग दिस सेशन. ऑल थैंक्स टू संजीव भानवत सर. And I hope that we will be exploring how media shapes perceptions and drive policy and amplifies outreach. While I was just going through the topics which the presenters are coming up in this sessions, so I'm very hopeful that we will be, coming out with very good solutions and a very good research. And with this, I would like to start the presentation of the presenters. I hope they are ready with the chronology or the numbers, Miss Ashwarya?
Yes, ma'am. Please continue. Call up the presenters.
So we can start the
Yes, ma'am.
presentations.
Yes, ma'am. Should I call the presenters?
Yeah, please, ma'am.
Okay, okay. K. Ravi Kumar. First presenter is a K. Ravi Kumar. Title of his research is From Information Overload to Informed Citizen, Media Literacy as a 21st Century Competency. K. Ravi Kumar. I don't think he is in this session. Let me call the next presenter. Akanksha Sharma, Dr. Akanksha Sharma. Dr. Akanksha Sharma.
She is also not there, Rama, in the session.
Okay, ma'am. Suman Rathore, research scholar, Banastali Vidyapeeth. Suman Rathore.
Yes, we have Suman with us. Suman?
Suman, kindly present.
Yes, ma'am. 1 minute.
I would like to inform all the participants that you have 5 minutes for presentation and 2 minutes for question answer.
Namaskar, everyone. I'm Suman Rathore from Education Department of Banastali Vidyapeeth Nivai. My topic is teacher empowerment through AI-based digital tools, 21st century skills perspective. In the introduction part, I would like to tell about in the 21st century, teachers are expected not only to deliver content, but also develop learners' critical thinking, creativity, collaboration, and communication skills. Artificial intelligence-based digital tools offers powerful ways to support these expectations by transforming how teachers plan, teach, assess, and manage classrooms. Therefore, the central focus of this paper is to explore how AI-based digital tools can explore teachers in the digital era rather than replace them, and what kinds of competencies teacher must develop to harness these tools for better student learning. Now, concept of teacher empowerment. Empowerment refers to professional autonomy and decision-making ability, teachers having a meaningful voice in planning curriculum, selecting methods, and using technology according to their learners' needs. Empower teachers shows confidence in both pedagogy and technology use. They are willing to experiment, integrate new tools, adapt instructions based on evidence from the classrooms. Now, 21st century skills framework includes critical thinking, communication, collaboration, creativity, digital literacy, and technology integration. Now, AI-based digital tools in education. Artificial intelligence is transforming the education system by introducing tools that make teaching smarter and more efficient. First, we have automated assessment system that helps teachers check assignments and evaluate objective type responses instantly. Now, next is AI-powered lesson planning to texts, translation, and content generation like summarize worksheets, questions, and etc. Now, how AI empowers teachers, reduces workload by automating routine tasks, supporting differentiated, improves planning efficiency, builds teacher and AI assistants, Google Classroom, AI features, Khan Academy, Microsoft Reading, Progress, Quizzes, Canva AI, etc. Now, there are some benefits for teachers. It gives teachers more time for creative and interactive teaching by taking over repetitive tasks. AI also strengthens digital competence, which is essential in 21st century classrooms. It increases student engagement through personalized and interactive tools, and most importantly, it supports continuous professional growth by exposing teachers to advanced digital strategies. Now, there are some challenges in AI integration, lack of AI training for teachers. Despite its advantages, AI integrate comes in with challenges. One major challenge is the ethical concerns such as bias in AI-generated information and misinformation must also be addressed. Data privacy and cybersecurity risks are important, especially when students' data is involved. And the digital divide, unequal access to devices, and the internet creates barriers in effective AI adoption. And now, need for teacher AI literacy. AI literacy is very important in 21st century era. Understanding how AI works, using AI responsibility and ethically, evaluating AI generated content, and promoting digital responsibility in students. Now, some recommendations are there. To ensure smooth and responsible AI integration in education, a few recommendations can be considered. Firstly, institutions should provide professional development programs focusing on AI training for teachers. And secondly, there must be strong institutional support and digital infrastructures. Clearly, ethical guidelines should be developed so that AI is used safely and fairly. And lastly, inclusive digital policies are needed to be ensures equal access for all learners. And now conclusion. To conclude, AI has immense potential to empower teachers and transform education. Its effective use requires proper training, digital skills, and ethical awareness. When teachers are empowered with AI tools, they create enriched, innovative, and learner-centered classroom environment. So AI should be seen not as a replacement, but as a partner in teaching. Thank you.
Thank you, Suman. Ma'am, any remarks?
Miss Suman, thank you. It was a good presentation, but what I did not understand, what I couldn't understand in this entire paper is that was it a review paper or was it a survey study? What was the methodology you have followed? What was your objective? Because see, whatever you have presented is all known to us. We all are discussing it. I failed
Yeah.
to understand what your research question is. Why are you doing it? Like you said, automated assessment system is required. Are you sure that automated assessment system is not existing? And are you sure that many of the higher educational institutes, including mine, where we are using AI, where we are using digital tools, we are not assessing it? So that is my question. I failed to understand that what exactly is this entire study all about. And secondly, you said need for teacher AI literacy. This was all very generic. I need a proper objective, a proper hypothesis or research, because this is hypothetical situation that you are saying that AI is very important and it should be given and it should be taught to teachers. So are you sure that it is not being taught? Where this study was conducted?
Actually,
What
ma'am,
was the geographical area? Who was the participant? Because to me it appeared like an essay. It was because the methodology was lacking, the objectives were not there, research questions were not there, you did not show any assessment tool. On what grounds you are coming up with the assessment, with the conclusion or with the analysis? That I would like to know.
yes, ma'am. Actually, this is a descriptive type research paper, and actually,
One
my
second.
topic.
If just a second, even if it was
Yes,
descriptive type research question, Ms. Suman, it should have proper literature review. The thematic analysis of the
yes,
literature
yes, ma'am.
review was supposed to be there, so that we could have understood that who said what in which year, and on that basis you are concluding.
Yes, yes, ma'am.
Yeah.
You are right, ma'am. But actually, my thesis topic is study of 21st century skills in relation to teacher empowerment. So actually, I have taken government schools and private schools both in my thesis. So,
So
I
these
just
government and private schools teachers were being studied.
yes, yes, ma'am. I just I just conclude with like a in abstract form. You can see in this paper. Otherwise, I yes,
See, it
yes, ma'am.
was not to bring you down. It was
Yes, yes,
actually
yes,
when we are sitting into a session,
yes, yes.
especially which is based on research. So your presentation should have those research questions, so that the people who are
Yes, ma'am.
hearing your
Yes,
presentation
understood,
must
ma'am.
know that with this research question the the problem has started, and now the researcher is taking us through this path to reach to the
Okay,
conclusion. So
okay,
that
right,
is
right.
what is required. You
Yes,
can
yes, understood.
revise it and make it
Yes,
more
yes.
uh,
Uh,
proper.
yes, ma'am. Thank you
All
for
right,
your
then
suggestions, ma'am. I yes, agree.
all the
Thank you, ma'am.
best.
Okay, ma'am. Thank you.
Uh, Next presenter, Mr. Manjunath MO or Dr. Shiva Kumar. Anyone? We have same co-author here. Digital media as a tool in accessing health information among adult girls of Naika community in Vijayanagar district, Karnataka, a qualitative study. Do we have Mr. Manjunath? Okay. Muskan, Muskan Gothewal, Dr. Bala Lakhendra.
Ma'am, Muskan
Muskan has
Gothewal.
joined.
Yes,
I
I'm
think
here. I'm
Muskan
here. So I'm going to start my presentation with the permission of the chair.
Muskan, you can present after, sir.
Okay.
Okay, so just a minute. Let me put on my PPT. Just a minute. Yeah. So is my PPT visible, madam?
Yes, sir. Very much visible.
Okay. So, Honorable Chair, Madam Professor Sheel Nidhi ji, my sincere greetings to you. Honorable Professor Sanjeev Bhanawat sir, under whose leadership we are growing ahead, and all the participants. The title of my presentation is Public Health Communication in India, Ayushman Bharat Scheme, Awareness and its Impact on Rural Women of Varanasi District. You know, when this circular, we received the circular, and I thought I should do something on health communication. Particularly in India, we are lacking in terms of health communication. But in few years, if you see, we are getting health support by the government, and in many of these states, including Bihar, Uttar Pradesh, Madhya Pradesh. Particularly Bihar is known as the Bimaru state, because facilities are not there. But with the help of this Ayushman Bharat scheme, people are getting help from Government of India, and this scheme is helping. So it came to our mind that why we should not do a study on Varanasi district, because my university is situated here. So with this aim, we started this. So quickly, I will be talking about the abstract of this presentation. So public health communication plays a vital role in improving health awareness and promoting healthy behavior among India's diverse population. It involves the systematic use of communication strategies to inform, educate, and motivate individuals and communities about health issues. We all are aware that the main role of the communication, whether it is radio, whether it is print, it is inform, educate, and entertain, and empower the individual so he or she may get the benefit of the given schemes. So with this brief, we started this, and the main aim of this paper is to examine the surrounding the Ayushman Bharat, ABP, usually we call it ABPMJAY, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So in this scheme, people from those who are not having proper this financial support, and they are having the list in the village or in the panchayat, so they are being given this Ayushman Bharat card, and under this scheme they are being covered. So the main aim of this paper is to examine using a cross-sectional survey from purposely selected village in Varanasi. We selected the villages of Varanasi, which I will be talking later when I will be talking about the methodology. And then we also focused on policy recommendations, and then what Government of India is planning, and how self-help groups, we all are aware about self-help groups of India, and this is empowering women of Uttar Pradesh. We have seen its impact on Bihar election, although we are not going to discuss about that because this research paper is not directly related to that. But we can see the empowerment with the help of SHG, and SHG is also playing a very important role in terms of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. If we go through the this UNICEF or WHO scheme, WHO mandate, so they say that we need, or everybody should have proper facilities to fight against vulnerable diseases. Not only that, even in terms of COVID, we have seen how government of India supported the mass, supported the people, supported the public, and this vaccination program was launched, and how we saved us. So this also a very important thing. So this paper investigates how information about Ayushman Bharat Pradhan Mantri Jan Arogya Yojana reaches rural women of Varanasi district, the degree of their awareness, and the impact on healthcare access and financial protection. So with this aim, we did it. So main objectives of this study was to assess the level of awareness, whether people are aware about it or whether they are getting benefits out of this or not. Second objective was to evaluate the effectiveness of public health communication channels, because in Bihar and Uttar Pradesh, all the time I'm talking Bihar because I was relating Bihar to UP, how the public health system is better, and then public PSC, primary health centers, all the villages in Punjab having primary health centers. So whether they are working properly or not. The third objective was to analyze the impact of awareness on healthcare utilization. Fourth objective was to identify socio-economic and educational factors, whether the socio-economic status helps the people for their healthcare, or education, how education is helping them, or this having influence on this, and then to suggest strategies for improving health communication and outreach. So with this, as madam was asking, then whenever we do some research, there must be some research questions or hypothesis, or sometimes both are there. So these 4 questions were included for this research. What is the level of awareness of Ayushman Bharat among rural women of Varanasi districts? What are the main channels through which they women received this information about this scheme, and to what extent has this Ayushman Bharat influenced healthcare seeking and financial protection among the respondents? And finally, what barriers prevent eligible women from accessing the scheme's benefit? So these with these questions, this research was completed. In terms of population, Varanasi is a big district where we cannot go, and I was supposed to finish this research paper. So I can say that this research paper can be very pilot project can be, because with 100 respondents we cannot claim that this is the status. The data cannot be generalized. So just to see the awareness level and the availability of the doctors, with this aim, this research paper was completed. So for this we selected 4 villages of Varanasi district in different segments, and with the help of cheats, we did it. There are more than 75 villages. So out of that, we selected 4 randomly, and then we visited there. And total sample size, 25 women from age group of 18 to 60, they were selected, and this is how we did it. And out of this, 100 were taken. A structured questionnaire in Hindi included the following models. We asked about their profile, demographic profile, their knowledge, then their position of Ayushman card, whether they are having a Ayushman card or not. If not, whether they have registered themselves or not, or what is their status. Then their experiences about hospitalization, because when we say that Ayushman Bharat will give you strength, will give you opportunity if you are having a serious disease or something which is very expensive, you can go to any hospital, you produce your Ayushman card and you will be treated. So just to know whether this is working properly, what was the respondent in last 2 years. So this was also one of the aim, and this is how the questionnaires were put there. Then source of information, whether they received this information from radio, television, or now everybody is talking about social media. Even at panchayat level, they are having community meetings with video, and the ASA workers are also there. So what was the source of information about Ayushman Bharat? This was the thing. And then what are the barriers about this? Whether lack of documents or lack of knowledge, even sometime their distance may be one of the reason. Till today, there are hundreds of villages. Otherwise, I'm talking this out of this context, but it is the fact that still today, even there was Pradhan Mantri Sarak Yojana and Sarak Pahunch Path was there, but still I have visited the villages. Still there are many villages which is not connected with the road, and main constructions are not there. So this was also, so whether due to the distance they are facing problems. So just to know the barriers about this, and health seeking and financial burden, it was also something when we asked the questions. So respondents answered about these things. So on the basis of these things, I will quickly going for the findings. In terms of awareness and registration, we found that they have heard about Ayushman Bharat. 68% women said that they are aware and they have heard and they know about it. Correct basic knowledge about the thing, really about the cashless hospitalization and the amount, what up to what, which amount or up to what they can be admitted. So only 34% respondent, they said that yes, we know it, and we can take this benefit out of this. So this was a very less number, although 34, it depends how you take it. But when 68% of population, when they are aware about it, when they have heard about Ayushman Bharat, then only 34% are having the basic knowledge about the whole idea they are having. 52% respondents, they said that they are having this Ayushman card at their home, and 40% they said that yes, when it was verified, means if you can show your this Ayushman card, and so 40% women actually they said that yes. And eligibility status, whether they are aware or not, what is the eligibility criteria, who can be given this Ayushman card, or who can be benefited. So only 30% women said that yes, we know it. And of course, this is also not good signal, and still media is doing very hard work. Even ASA workers are going, but result is not there. In terms of source of information, respondents selected multiple sources. Out of the 100, 44%, they said that they received this information through ASA, ANM, or Anganwadi worker, because they are the in Uttar Pradesh particularly, Anganwadi workers are doing a wonderful job, and they are going at the grassroots level. They are working and they are helping the women as well as children. So 44% are there. Local camp, Gram Sabha, only 22%, because when Gram Sabhas are organized, one of the women said that even they hesitate to talk to video block development officer. They feel that no, they are bigger. So if you want to make it Viksit Bharat, everybody is talking about Viksit Bharat. So this gap has to be removed. Okay. Very less number, that is 18%, all said that this is out of radio and television. I don't understand why. But if radio is claiming that data is reaching to 90% people and they are covering 99.9% population, then why it is not reaching to the people? There may be some problem with the message, or maybe some problem in the content.
Sir, sorry to interrupt. We should come on the conclusions. Yeah.
Yes, I'm coming. So finally, okay. In terms of policy implications and recommendations, Uttar Pradesh is still not so literate, particularly literacy rate in women is very less. ASA workers are really equipped and they can be a very good source of information. Finally, in terms of conclusion, I will say that Ayushman Bharat has potential to substantially reduce catastrophic health expenditure and improve access to tertiary care for vulnerable populations. In Varanasi, rural communities, household level registration has advanced, but important gaps persist in actionable awareness, female-centered access, and actual utilization of benefits. So it is needed that much more has to be done, and if it is done, really, Government of India is going to do wonder for the rural women, particularly those who are suffering from different diseases. The number of patients are increasing in terms of cancer also. And I have different reports are there regarding the cervical cancer and all. but time is limited. Any other platform, or I will be sharing this PPT and my paper to Honorable Professor Sanjeev Bhanawat sir and to the chair also. So there, one if somebody is interested can go and read it out. And these are the references we went to, and we did review of literature. And this is how this research paper was completed. This research was completed. So thank you so much, madam, for your kind permission to present my paper, and thank you so much.
Sir, thanks to you. It's my honor to, listen to you. It was a very well structured study, and it actually brings a lot of information that what we are still lacking, and in terms of media, what we can do. And we should take it to policymakers that still media is lacking behind, because if 30% are saying that we know, and are having the basic knowledge, that means the major role of media is lacking. We must go there, reach to the, and it was just a study of 4 blocks where 200 sample was taken up. So what would be the status of the villages or the women who are living far and we could not reach them? So media has the power, and I still say that radio is a very effective medium, but it actually has brought out a lot of information. And sir, just to add, if future implications, like what should be done, since you have studied a lot and you have brought out wonderful findings, so you could also suggest, suggestions and recommendations you could give, that how could these self-help groups or community radio stations, like in Karnataka or Tamil Nadu, they are doing wonderful job, so how could they be utilized, and if mainstream media is not reaching to them? But otherwise, sir, it was a wonderful, very well structured study. My compliments to you.
Thank
Thank
you.
you very
Quickly, just responding your thing. Unfortunately, in Varanasi, there is no community radio station. One radio station is started with the Sunbeam Radio, which was a campus radio. But we are planning. Banaras Hindu University is planning for a community radio, and we will be utilizing this. Another radio is one of the very important radio, or those who are in communication, they might be aware about Sangam Radio. Sangam Radio is run by the Dalit women, and they have empowered themselves. Sangam Radio of South. So likewise, if we can do something, so I have also given some suggestions, but due to lack of time, and I could not include that PPT. So even I'm going to meet the director, All India Radio Director. Varanasi is having a radio station and Doordarshan as well. So I'm going to meet, and I'm going to give them these details and ask them that you do something so that you reach to the mass, or to the people. Because if Varanasi having so many things, and this is the constitution of Prime Minister, and even people are not aware, so that is painful. So I'm sure, and I assure you that in future I will be doing a project on this. Thank you, Honorable Madam Chair.
Thank you so much, sir. Ma'am, can we have the next presenter?
Yes, ma'am. Muskan,
Yes, ma'am.
you may present.
Ma'am, is it visible?
No, Muskan, no. Yes, it is visible now, Muskan.
PPT is visible.
No, you have shared your screen. It was visible earlier. Yes, it is visible now.
Is my PPT visible?
No, Muskan, your screen is visible, but not your PPT.
Now?
Yes, it is visible now.
Okay. Good afternoon, everyone. My name is Muskan Gotharwal, and I am a PhD research scholar in social work. Today, I will be presenting my paper titled Evolving Media Portrayals of Disability from Stereotypes Towards Inclusion. To begin with, this slide provides a brief introduction to the topic. Media is a powerful social institution which helps in shaping public awareness, cultural values, and collective attitudes. Media plays a significant role in the field of disability because majority of the population.
Muskan, skip the introduction. Excuse me. Muskan, skip the introduction. Come on the objectives and research questions.
Okay, ma'am. Um, Ma'am, the objective is to present a thematic literature review. Theme
Okay.
1 is the dominance of stereotypes. Media continue to portray outdated stereotypes that reduce disabled individuals to their impairment. Some common media portrayals of disability include the tragic victim, object of pity, inspirational achiever, dependent, and incapable. Theme 2, underrepresentation and invisibility. Limited visibility of disabled individuals in mainstream media is dominant theme across all sources. Representation rarely shows the true proportion of disabled people in society, even in countries with strong media ecosystems. Theme 3, language and terminology. Language reflects and influences attitudes. Most studies highlight problems with media terminology following a medical model using words like sufferer, victim, and afflicted. Theme 4, gender and disability in media. Research shows that media portrayal differs significantly based on gender, class, caste, rural or urban location, and type of disability. Disabled women remain the most underrepresented, invisible, and stereotyped group. Theme 5, shifts in digital platforms. Traditional media remains slow to change, whereas digital platforms have created new approaches for disability representations, advocacy, and community building. Social media, disability activism, and user generated content have allowed individuals with disability to represent themselves instead of waiting to be represented by others. Gaps in the existing literature. Overall, existing literature reveals that media portrayal of disabilities is still limited, stereotypical, and provides limited empirical studies. Most research studies are limited to media content and does not examine structural barriers like newsroom policies, media hiring practices, absence of disabled journalists, or editorial policies. This slide connects the findings with existing literature. Media has historically portrayed disability through narrow and repetitive stereotypes. The studies collectively demonstrate that media representations create social distance rather than inclusion by focusing more on impairment than identity. It has also been discovered that the media still lacks in making content accessible as there is no use of sign language and audio description. Additionally, disabled individuals are rarely interviewed as experts, are absent from mainstream debates, and are excluded from newsroom employment. Here I present practical recommendations for media professionals to improve disability representation. Adopt rights-based frameworks by rejecting medical and charity-based narratives by focusing on dignity and equal representation, ensuring accessibility in media content, promoting disabled representation both on screen and behind the camera, like writers, editors, anchors, researchers, and technicians. This slide concludes the presentation. Media plays an important role in creating what society accepts as normal or desirable. Rising digital platforms provides a great opportunity to move beyond charity-based narratives. Disability representation is not only a media issue, it is a matter of cultural justice, human rights, and social transformation. Growing advocacy, digital media, and disability rights movement carry strong potential to reshaping societal perception despite so many challenges. Media has the power to either reinforce stigma or or build inclusion. This brings me to the end of my presentation. Thank you.
All right, Muskan, it was a good study. I would just quickly like to ask that this thematic literature review which you have done,
Yes, ma'am.
uh, do you have, can you show me how many papers have you reviewed, or, on the basis of the themes where the segregation was the done, extortion rate kitna tha, from where you have collected the data, the secondary data, that I would just quickly like to see.
Ma'am, I have studied 9 research papers. And there are 5 countries: India, Italy, Malaysia, Canada, and Hungary.
Out of 9 research papers, you came out with 4 thematic themes, major themes. Are you sure?
Yes, ma'am.
See, as of now, the paper is fine, but my only advice or suggestion to you is that the if it is a thematic literature review and you are coming up with major 4 themes, so
Yes, ma'am.
9 research papers are not acceptable. I mean, minimum 90. I was expecting at least 4 to 5 thematic analytical tables in your study because the topic is good. So the main methodology of your research is literature review, thematic literature review. Themes should have variables, and on the basis of those variables, at least 9 or 10 tables should be there in your papers to make it a
Yes,
standard
ma'am.
paper.
Yes,
And
ma'am.
also go for more papers.
Yes, ma'am.
All right, not less than 50 are acceptable in thematic analysis.
Yes, ma'am, I will add.
Yeah, you add and study those papers, then you will automatically get good ideas and themes and variables. On the basis of that, you will see that how well you can define it more.
Yes, ma'am.
All right, thank you. If anybody else is
Thank you,
having a
ma'am.
question, or we can have the next presenter.
I think, ma'am, we can move on to our next presenter.
Yeah.
Next presenter, Nandini Prabhat Indora.
Yes, ma'am. I would like to present. Just a minute.
Kindly share.
Yeah. Is the PPT visible, ma'am?
Yes, it is visible.
Okay. So first of all, I would like to greet everyone. Good afternoon to everyone present here. I am Nandini, a journalist student of Modi University of Science and Technology. And today I would like to present my research titled The Unseen Conflict, Nepal's Political Instability, Media Narrative and Humanitarian Response. This study of media narrative and humanitarian response explores that how the Nepal's internal unrest, though not a weaponized war, has created humanitarian consequences and how media narratives shape global understanding and response. My study explores that Nepal have not faced any serious weaponized war, but still it faces humanitarian consequences because of the continuous political unrest. And we shall also discuss the main reason behind this continuous political unrest. Also, my study explores that how media here act as a lens and reflect the internal situation of Nepal to the global world. Proceeding to the research objectives, the objective behind my research are to understand the background of Nepal's Gen Z protest, analyze how social media act as a game changer in the whole protest scenario, what are the humanitarian responses, and finally, to understand the study that how media narratives influence the public opinion. I adopted qualitative resource approach for my research because it allows the deeper exploration of emotions, experiences, and public perception. To understand the exact situation of Nepal, we must understand the political history of Nepal. The country transitioned from monarchy to constitutional monarchy to democracy in 2008. Till 1990s, it was ruled under monarch. Then, after Jan Andolan and the Maoist insurgency, a decade-year-long war took place, civil war took place, and finally in 2008, monarchy was completely abolished and officially abolished. But though it was celebrated as a victory, but still this do not lead to the stability. There was frequent leadership changes, nearly 13 prime minister changes in the tenure of 15 years. Also,
Nandini, go to the methodology and analysis part.
now I adopted qualitative research approach for my research. I studied research papers, articles, and media reports to for this research. And then coming towards the recent Gen Z protest of Nepal, as you all must know that in September 2025, all the Gen Zs flooded on the streets. It was a turning point for the Nepal. The immediate trigger was the government's ban on major social media apps. But the deeper issues were corruption, political instability, frustration among youths, and lack of opportunities. Nepal has a very almost 50% of population below the age of 30 years, and the lack of opportunities and the economic stagnation led to the deeper frustration among them. Though because of this ban, the social media acted here as a game changer. They started using VPNs and different VPN networks and different social media platforms to voice their situation to the global world. Moving towards the media narratives, the media narrative played a crucial role. It amplified the youth voices, exposed corruption, and brought global attention to Nepal. Citizen journalism and hashtags became tool of empowerment. The humanitarian response, traditionally the humanitarian response in Nepal were linked to natural disasters, but today the crisis is socio-political. Many NGOs like UNDP, CARE, Save the Children came up, and with the help of digital media, crowdfunding has also been in support of the affected families and people. Many mental health awareness campaign have been started. The key findings of this research, my findings shows that the Nepal's instability is cyclical and deeply tied to governance. The youth are the most affected and migration has been a humanitarian concern. Media framing converted the protest from a local disturbance into a global youth rights movement. Digital activism redefined protest culture, and humanitarian organizations responded mainly because media visibility brought global pressure. In conclusion, Nepal's conflict highlights how media does not merely report events. Media also shapes the consciousness. Through digital spaces, Nepal's youth transformed their sufferings into a collective call for accountability. Media narratives mobilized humanitarian support and turned an unseen domestic conflict into an international concern. So, thank you for allowing me to present. Thank you, ma'am.
Good work, Nandini. But again, my question would be that I couldn't understand the analysis part the way it should have been presented. I need to, if it was a qualitative study, again, it would be based on the secondary data. How much secondary data have you studied? How many research papers? And on global front also, this needs to be studied that what did other countries say? What are they perceiving? Is this a cumulative conclusion that social media is responsible, or social media is framing the mindset of the youngsters? This remains still unanswered. So the topic is good, but a depth of study is required in it. So please consult more papers and make it more analytical. Okay. Otherwise, the topic is good. Thank you.
Thank you so much.
Next.
Yes, Dr. Mohammed Shamim Khan.
Ma'am, please give me 5 minutes.
So if you need 5 minutes, I think we can take another presenter.
Yeah, after that you can, I can
Okay.
present.
Okay.
Thank you.
Aishwarya Rathore. Aishwarya Rathore.
Excuse me, madam. One of the participants, Ojakyu, his this microphone is on and creating. Yeah, so ask, please request him to put off his mic.
Yes, yes.
Please.
We'll check. Aishwarya. Professor Manawar.
Yes, ma'am. Good afternoon.
Good afternoon, sir.
Yes, I am present. Respected Professor Sanjeev Bhanawat, sir. Respected Session Chair, Dr. Sheel Nidhi, ma'am. Good afternoon. And all participants, good afternoon to all of you. I am sharing my PPT. See, here a segment. Eh? Oh, chaliye. हाँ. ये. Is it visible?
No, sir, not yet.
Okay. Just a second. Okay. वहाँ चलिए ना. एक सेकंड. मिनिमाइज करिए और मिनिमाइज करिए. यहाँ पे ये पीपीटी.
Sir, do you need minute?
Yes, please. This is being shared. Yeah, okay.
By the time, can we invite some other participant to utilize the time?
I think
Yes,
some
ma'am.
this person is ready from Nagaland. We can have him.
I'm
Yes,
also ready. If you allow me,
Windy.
I can present. ma'am.
Yes, ma'am. Allow someone.
Yes.
Hello.
Hemam Windy.
Hello.
Next presenter, Hemam Windy.
Am I audible, ma'am?
Yes, yes, ma'am, you are audible.
ग्रीन कर दीजिएगा अगली बार. उसके बाद पीपीटी मिलेगा.
Is my screen visible, ma'am?
Yes, it is visible.
Okay. So good afternoon, everyone, all the participants, ma'am, who is sharing the session. Today, I'm going to be presenting on my paper, Community Radio for Wetland Conservation, a case study of Radio Loktak of Manipur. So my study is a very brief descriptive study, which could work as a foundation for many other more resources. So basically, I'm studying on the role of community radio, particularly Radio Loktak, for the wetland conservation efforts as a part of the wetland conservation movement. So community radio, we already all know that it is a radio operated by the community, for the community, about the community, and by the community itself. And according to World Association of Community Radio Broadcasters, it is cited that community radio broadcasts should be broadcasted in local languages. We should focus on issues related to the community. So the sole philosophy of community radio is to give a voice to the voiceless, the mouthpiece to the oppressed people, and generally a tool for development, which is very much aligned with the community radio that I chose, that I will show later in my further slide. The Radio Loktak of Manipur, even its motto is Voice for the Voiceless. So the community radio stations, they engage in local audiences, also focus on the issues specific to the issues and problems of this specific community. So we can say that, I mean, it has been already even proven by so many researchers that it is very much effective for grassroots level communication. Now, let's come to the part of the problem, that is wetland degradation in Manipur, and what media and specifically community radio can do for it. So Manipur is the northeastern Indian state along the Indo-Myanmar border with a population of 28.56 lakhs. So Manipur geographically can be divided into two main regions, the hilly terrains and the valley. But even though the hilly terrains have 90% of the area, most of the major wetlands, basically 90%, is situated in the central valley of the region. So wetlands are very much important biological assets, which is also known as the kidney of the biodiversity, because they provide so many benefits, right? Like recycling nutrients, water purification, providing drinking water, and also many flora and fauna. And it has been reported and discussed on Manipuri media that wetland degradation is very much evident, and we need immediate action to save our wetland. And among all the wetlands in Manipur,
Excuse me, Miss Wendy, if you could come on the case study and its interpretation.
Okay, thank you, ma'am. So ma'am, I'll start with the profile of the Radio Loktak. This is also one my area of the study. So Radio Loktak, it started as Tamna Radio, as an unofficial, unlicensed broadcaster, but rather later rebranded in 2017 as Radio Loktak. And ever since its inception, it has broadcasted many programs based on environmental education, wetland conservation, and many more developmental communications. And among all the programs of the Radio Loktak, I have found very specific 4 programs that is very much related to wetland conservation. Number 1, Aikogi Loktak, which literally translates to our lake. And number 2, Aikogi Part, which translates to our lake, for the general lake, not specific to Loktak Lake. And then we have Patni Singa Unaba, interactive mobile show, where the theme of this broadcaster Radio Loktak go into these wetland areas, interview the wetland dwellers, and ask them about their struggles, their livelihood, and everything concerned. And then again, we have another program format, that is Expert Talk. Actually, this is a general talk show where they focus on so many more issues, but they also have issues based on wetland conservation. And now let's come to my findings and discussion. So these are my demographics. I'll be very brief with it. So I have 37 respondents, and among all of them, my respondents are more on the more mature adult, which range from 55 and above, and then followed by 31 to 50. So it basically just tells that my respondents are predominantly the older generation, not the younger generation. So which would also mean that their involvement in digital media would be very much less comparatively. So my study is done on 3 main areas, main settlement around the Loktak Lake. local areas known as Thanga, Ithing, and Karang. Karang is the island inside the Loktak Lake. So my study is done on this, and I'll go directly to the media reach and preference. So from my table, we can know that all of my 37 respondents choose radio as a media tool they use to access information. So which basically proves that radio is a universally accessed medium out of all the medium, basically because of its affordability, cheap, and all that. So then again, it also shows that mobile phone users is 81%, reflecting on the increasing digital penetration. But at the same time, I find very less internet connection, even though they have access to mobile phone. And when it comes to the listening preference, Radio Loktak, the 33 respondents, which is 89% of the respondents.
Sorry to interrupt you, Wendy. We can understand this. What were the challenges you have encountered while doing this case? And also the conclusion part, if you could cover quickly.
Oh, okay, ma'am, I'll tell you that. So my study is a kind of a continuation of an earlier study that I had. So my the sampling method I use is a partnership method. I study on all the people or responded that I already knew that are radio listeners. So when it comes to the challenges, I would say that I would point out to the limitations of my study instead, ma'am. So my study is basically just descriptive. So it doesn't measure the relation between their radio listening habit and their awareness or their desire to participate and all that. But I could find that Radio Loktak pretty much serve as a very trustworthy source of information for this wetland dwellers specific to my area of study, and they among all the programs format that I have mentioned before, my respondents like the Patni Singa Unaba, the interactive, the mobile theme, which basically means that they want more representation of the stories of the local narratives, their struggle, more on the media, and yeah, even though their listening frequency was very high, there was very much less participation. Only so only 5% of my respondents involved themselves in participation through phone call of radio phone-in programs of the program production. So even though the listeners are very much high, the participation level is very much low. So we need to furthermore study on how to get more interaction from the audiences.
All right. Thank you, Wendy. It was a good presentation. The only part I would like to add is that few of the participants who are running the show, who are running this community radio should be interviewed, or or kind of focused group interviews while the programs were on could have had been taken, so that their efforts could also be noticed, that how are they trying to bring the change. But otherwise it is fine. Thank you.
With your permission, madam, quickly, with the permission of the chair.
Yeah, please.
Because Wendy, what she has written, she is assistant professor. So the way work is done, I don't think it is not discouraging. Again, I'm telling Wendy, but the thing is that you said that 37 respondent. How you selected the 37, and what madam suggested. So did you visit Radio Loktak?
Yes, sir. I have visited. I have had so many interviews and discussion with Uncle Sanjay.
How many staffs are there? How many staffs?
There is the station director. He's basically pretty much involved in all the production, and he has an assistant who is also the announcer.
So only 2 persons running the community radio.
Yeah.
Okay. And what about their finance? How they are? Because financial part is very important.
Yeah, sir, they're struggling. They're struggling on their part. They also voiced out that they're having very much very low.
They are struggling. How they will work for the society? Anyhow, good. If you are really doing on this, It is going to be a great thing. So Manipur, and you are from Nagaland. Nagaland is not
No,
having any
no, sir.
community
I'm
radio.
from Manipur. I'm from Manipur. I have just
Working in
recently
Nagaland.
started working in Nagaland.
Okay, okay. Okay, anyhow, congratulations. Very good. But in depth, a little more study is needed. Okay.
Yeah, not this, sir.
Yes, ma'am.
Yes, so Dr. Manavar.
Yes, please. Yes.
Now we are running short of time. 3:30 we have to finish because I think the valedictory session is from 3:45. So I would request the presenters to kindly wind it up as soon as possible.
Is it visible, ma'am?
Yes, sir, it is visible.
Yes.
Could you wind up your presentation within
Yes,
5 minutes?
I'll do it as earlier as possible. Yeah. Next slide. Yes, good afternoon to all. Respected Chairman and Organizing Committee and fellow participants. I am Dr. Munawwar Alam. Today, I'll briefly present my study titled Digital Platforms as Political Tools, Communication Strategies in Indian Elections between 2000 from 2014 to 2024 with a case study of NCR New Delhi. My research examines how digital media has reshaped political communication between 2014 to 2024. My finding is, the abstract says, between 2014 and 2024, India witnessed a massive shift from traditional campaigning to digital first political communication. My study focuses on NCR Delhi and looks at how political parties used platforms like Facebook, X, WhatsApp, Instagram, and YouTube for voter mobilization, targeting, and narrative building. The study also evaluates how these strategies influenced voter behavior, democratic participation, and the rising challenges of echo chambers and misinformation. The objective of the study has been, first, to analyze platform specific political strategies, second, to compare how different political parties design and execute their digital campaigns, third, to understand how digital content influences voter perception and participation, and fourth, to assess why Delhi NCR serves as an ideal model for studying digital political behavior. Research methods used a mixed method approach. It included content analysis of social media posts from major parties, then in-depth interviews with campaign managers and digital strategies, and survey conducted with voters across Delhi's urban constituencies. These three methods were triangulated to ensure a comprehensive interpretation of the findings. Key platforms 2014 to 2024. Over the decade, different platforms played different roles. From 2014 to 2019, Facebook and Twitter or X were dominant for hashtags, leader-centric campaigns, and rapid reactions. From 2017 onward, WhatsApp became the backbone of micro-targeting and community-level mobilization. And from 2020 to 2024, YouTube and Instagram gained prominence with reels, shorts, influencer collaborations, and visual storytelling, especially among, among the youth. Next, Strategy evaluation. The evaluation of communication strategies is quite evident. In 2014, campaigns focused mainly on visibility and consistent slogan-driven messaging. By 2019, parties were using data analytics, behavior-based segmentation, and hyper-targeted ads. And by 2024, strategies had become highly personalized with AI-driven chatbots, microvideos, and platform-specific influencer ecosystems. Delhi NCR case study. In Delhi NCR, two contrasting models stand out. Aam Aadmi Party focuses on governance-based storytelling, highlighting education, health, and electricity reforms through testimonial videos and documentary-style narratives. BJP relied heavily on brand Modi, nationalism, emotional messaging, and coordinated digital pushes. These strategies significantly shape issue priorities, online sentiment, and the intensity of public debate in the region. Key findings. The findings show that digital media has deeply influenced political awareness and everyday political conversations. Visual and short form content emerged as the most persuasive. Digital war rooms played a crucial role in narrative control. However, echo chambers, polarization, and misinformation intensified. Digitally active constituencies also showed higher political engagement and turnout. Conclusion is digital platforms have fundamentally redefined political communication in India. Elections today are shaped by hybrid media ecosystems, AI personalized outreach, real time engagement, and micro targeted messaging. Understanding these shifts is essential for ensuring transparency, accountability, and democratic integrity in future elections. Thank you very much.
Undoubtedly, so digital platforms have actually changed the scenario of political campaigning or political presentation, and it showed from your study that how soon, as soon as these social media platforms with the WhatsApp were launched with Reels, Instagram, and all, how fast, rapidly this scenario has changed, and it is now, I would say, a game changer in the field of politics also. Like even Modi, we can see him everywhere, and he remains very active on social media. And the study is good, undoubtedly, but since you started from Mumbai, but you came to Delhi NCR, which I wasn't able to connect that. Why did you take cases from this place?
No, I'm working in Noida. The affiliation university is in Mumbai. I have not
Acha,
been in
okay.
Mumbai. The study conducted in Delhi. And
Okay,
in fact,
okay, because I was in that realm that you were somewhere
no,
there, and why did you choose Delhi NCR? All right, it was
madam,
a good study.
I work in Satyam School of Journalism and Mass Communication,
Acha,
at
okay,
Sector 62 Noida. This is affiliated
all
to
right.
SNDT Women's University, Mumbai.
Okay, okay, all right. Good study, sir. Keep it up. Yeah.
Thank
Can
you.
we have the next presenter?
Yes, Dr. Mohammed,
Ma'am,
if
may
you
I
are
can
ready.
present?
Okay. Yes,
May I present that?
yes, you may present.
Thank you. Is my screen visible to everybody?
Yes, Pearl, your screen is visible.
Okay, thank you, ma'am. Good afternoon to everybody. I am from BBI camp, pursuing student of BJMC, and my topic is of the research is touching the emotions, human emotions of the animated movies. And the introduction part of this की animation now मतलब सिर्फ children या adults के base पे नहीं है और younger audience उसको भी cater करती है animation movies. एंड ये एक क्रिएटिविटी एंड स्टोरी टेलिंग है. जैसे लाइव एक्शन मूवीज में आप थोड़ा सा एक्शन या वैसा देखते हो, बट एनिमेटेड मूवीज जो होती हैं उनके अंदर थोड़ा सा क्रिएटिविटी एंड इमोशनल साइड भी होता है. जैसे जैसे एआई थोड़ा सा एडवांस या एक्सपैंड हो रहा है, उनकी जो आर्टिस्टिक पॉसिबिलिटीज है वो भी बढ़ सकती हैं. एंड एनिमेशन एक कंटेम्प्रेरी मॉडर्न वर्ल्ड और एजुकेशन के लिए एक ऐसा मीडियम पार्ट बन रहा है आज के समय में. माय ऑब्जेक्टिव्स ऑफ दिस स्टडी कि पहला तो मुझे ये स्टडी से निकालना था कि कैसे एनिमेटेड मूवीज इन्फ्लुएंस कर रही हैं इमोशनल कनेक्शन को और यंग ऑडियंसेस का क्या एक व्यूइंग प्रेफरेंस है. सेकेंडली ये एग्जामिन करना था कि जो रियल लाइफ फिल्म मेकर्स है क्या वो लोग इंस्पायर हो सकते हैं थ्रू द थीम्स, स्टोरी टेलिंग स्टाइल एंड द कंसेप्ट जो भी एनिमेटेड मूवीज में है, और उसको कैसे इनकॉर्पोरेट कर सकते हैं रियल लाइफ मूवीज में. एंड थर्डली ये फाइंड आउट करना था कि आगे जो फ्यूचर रियल मूवीज बन रही हैं क्या उसके लिए हम एनिमेटेड मूवीज को एज ए इंस्पिरेशन ले सकते हैं. My literature review of our 20 question paper, sorry, research papers, जहाँ पे हमने मेन एक ये इंस्टीट्यूट ऑफ मेडिकल साइंस का लिया था, जहाँ पे उन्होंने 22 में ये कहा था कि एनिमेशन एक एज अ पार्ट प्ले करता है फॉर द विजुअल अटेंशन एंड कंजेक्शन, मतलब कि कैसे मेंटली आपको इमोशनली या फीलिंग दिखाने में हेल्प करता है. एंड माय 9th रिसर्च पेपर शोज की एनिमेशन एक बहुत मूवीज ने बहुत अच्छा प्ले पार्ट किया है बुलिंग को रोकने के लिए. एंड दिस इज फ्रॉम डिफरेंट कंट्री जहाँ पे एनिमेशन को यूज किया गया था कि बच्चों को सिखाया जाए कि बुलिंग इज नॉट अ गुड थिंग. तो लाइकवाइज मैंने ये 20 कुछ पेपर्स में से रिसर्च करी है. मेरी रिसर्च मेथोलॉजी जो इस पेपर में थी, इस टॉपिक पे जो थी वो थी क्वांटिटेटिव थी. मैंने रिसर्च क्वेश्चंस कुछ गूगल फॉर्म के थ्रू भेजे थे अपने टारगेट ऑडियंस को, जहाँ पे क्लोज राइटेड क्वेश्चंस थे, और उसके बाद उसमें यंग ऑडियंसेस और उनको टारगेट करने के लिए मैंने भेजा था. और ये मैंने परसेंटेज एंड फ्रीक्वेंसीज पे डाटा एनालिसिस किया है. फोकस इसमें मेरा ये था कि कैसा क्या इमोशनल एंगेजमेंट हो पा रहा है, इसका सोशल एविडेंस क्या है और एज अपील क्या है. कुछ मेरे इंपॉर्टेंट क्वेश्चनर्स थे उसमें से, जैसे कि आप इंटरेस्टेड हो मूवीज देखने के लिए, व्हाट जॉनर मूवी लाइक टू वॉच, हैव यू वॉच्ड मूवीज लाइक द ज़ूटोपिया या इनसाइड आउट आप देख सकते हो. ये सब बहुत डिफरेंसेस आप देखते हो कंपेयर टू इन रियल लाइफ मूवीज. क्या एनिमेटेड मूवीज इंपॉर्टेंट लेसन्स के लिए देखते हो, एंड क्या आप एनिमेटेड मूवीज बेटर हैं रियल लाइफ मूवीज के लिए. जो सर्वे निकला था, मैंने जो सर्वे भेजा था उसके हिसाब से ये था कि 92% जो भी आपको दिख भी रहा होगा उसमें उन्होंने ये इंटरेस्ट शो किया कि एनिमेटेड मूवीज कुछ होती तो हैं और इसका डायरेक्टली ट्रांसलेट करती है. 84% जो पार्टिसिपेंट्स थे मेरे, उन्होंने कहा कि जो सिर्फ चिल्ड्रेन के लिए नहीं है एनिमेटेड मूवी, वो ऑल एज ग्रुप्स के लिए, और ये साइकोलॉजिकल फैंटेसी, सोशल रियलिटी, इन सब के थीम पे भी ये दिखाती हैं. तो एनिमेशन को हम ये कंसिडर कर सकते हैं कि सिर्फ ये जस्ट फॉर किड्स नहीं है. 84% ये एग्री करते हैं और 88% ये कहते हैं कि रियल डायरेक्टर्स जो हैं उनको इंस्पिरेशन लेनी चाहिए फॉर द क्रिएटिव सिंबलिज्म एंड इम्पैक्टफुल मैसेजिंग के लिए. एंड लाइक दैट एनिमेटेड मूवीज ये भी है कि शेप करते हैं मॉडर्न सिनेमा एक्सपीरियंसेस को, यंग अडल्ट्स को, और उनको एक क्रिएटिव एंड एक्सप्रेसिव फिल्म जॉनर हो सकता है, और ये कोई भी देख के इसको समझ सकते हैं. मेरा डेटा एनालिसिस में जो की फाइंडिंग्स आई थी कि जो मोस्टली रिस्पोंडेंट्स थे वो कनेक्ट कर पा रहे थे एनिमेटेड मूवीज से, उनको ज़ूटोपिया, वॉल ई या इनसाइड आउट तरीके की कॉम्प्लेक्स इश्यूज की मूवीज समझ में आती थी, और उनको ये पता था कि 67% लोग हैं उनको इमोशनल डेथ एंड क्रिएटिविटी पता है कि इससे थ्रू हो रही है ट्रांसफर. एंड द कंक्लूजन पार्ट जो मेरा लास्ट पार्ट है इस चीज के लिए, एंड इसमें ये कि एनिमेशन जो एक वाइडली स्टोरी टेलिंग मीडियम बन सकता है। यंग एजुकेटेड सिनेमा अवेयर के जो लोग हैं वो लोग इसको समझ सकते हैं कि इमोशनली कितना कनेक्ट कर पा रही है ये मूवी। स्टडी ये भी हाईलाइट करती है कि क्या पावर है एक एनिमेशन मूवीज की रादर देन दी जो एक लाइव एक्शन या रियल लाइफ मूवीज हम लोग देखते हैं। एंड इट इज नॉट ओनली अ स्टोरियोटाइप की सिर्फ एंटरटेनमेंट के लिए। अगर जैसे आपने इनसाइड आउट या एनिमेंटल जैसी मूवीज सुना होगा तो उसमें वो लोग बहुत अच्छा इमोशनल कनेक्शन को शो करने के लिए दिखाते हैं या रियल लाइफ इश्यूज दिखाते हैं। एंड माय द लास्ट पार्ट ऑफ दिस रिसर्च इसकी फ्यूचर इम्प्लीकेशन क्या हो सकता है। तो एनिमेशन को हम एक इमोशनल एजुकेशनल टूल फॉर ऑल एजेस के लिए हम यूज कर सकते हैं। जैसे जैसे एआई या टेक एडवांस हो रहा है तो उसके लिए हम क्रिएटिविटी में डाल सकते हैं और उसको और अच्छा इनहेंस रिच बना सकते हैं। फिल्म मेकर्स इस टेक्निक को यूज करके मोर एंगेजिंग सिनेमा में इसको ला सकते हैं। एंड मीडिया एजुकेशन के लिए तो सबसे अच्छा पार्ट ये प्ले करता है। एंड थैंक यू सो मच।
All right. Good effort, Pal. Thank you very much. A bit of more study is required in it since it was a pilot study. And I would like to tell all the audience over here that she's a student of graduation, 5th semester, final year. And she was very keen to do this study. And this was a very small pilot study we did together. And she just presented it in her media research lab Viva also. And therefore, I thought that we must motivate these students by bringing them on international platform. So if anyone of you are having any question, the platform is open.
Very excellent, excellent, Miss Pal Agrawal, really wonderful. And you are young and youth. So good study. I congratulate you. Keep
Thank
it
you
up.
so
And
much.
yes. And you, as madam is telling that it is a pilot study, so you can
Yeah.
go for research. But at the graduation level, whatever you did, it was really wonderful. Every aspect of the research paper was clear, and clearly you presented the thing. Very good. Congratulations.
Thank you so much, sir. Thank you so much. And thank you so much, ma'am.
Congratulations to presenter, ma'am. It is very nice study for a graduate students.
Thank you so
Shall
much,
I,
sir.
shall I call the next
Wonderful.
presenter, ma'am?
Thank you. Can we have the next presenter?
Yes.
We are running
Ma'am.
short of time. How many presenters are left?
Ma'am, we have more. I think we have few more from last session. There were some presenters who were not able to present, so they also
Alright.
want to present here. So I think we should give participant 3 minutes time because we have more list.
Yeah, just the
Kanan,
topic, methodology, objectives and conclusion the participants should present because 3:45 we have our valedictory session.
yes.
So
Kanan
yes,
Kanan
go ahead.
Sharma,
Yes, ma'am.
kindly present.
May I start?
Yes, please.
Okay.
Please only give your research methodology analysis and your conclusion.
Okay, ma'am. Okay. So, first of all, a very good afternoon to everyone. My name is Kanan Sharma, and currently I'm pursuing my PhD degree from IIS Deemed to be University Jaipur. So, today my research paper topic is From Margins to Mainstream Positive Media Narratives Supporting Healthy Aging for Women in Institutional Care. So basically, the main focus of this paper is that how media plays an important and very influential role in bringing out the problems and disadvantages of the elderly women who are living under the institutional care, and especially in old age homes. So this was the introduction, but as we are running short of the time, so these were the objectives that the focus was that how media platforms depict elderly women in Indian old age homes, and whether they are covering the true stories or not. Then it also focused on the various social, digital campaigns and hashtags, which were started in the support of the elderly people of India. So the research methodology I used, the approach was qualitative in nature, and the field I selected was Jaipur city and the old age homes which are in the Jaipur city, like Atmanirbhar Old Age Home, Ashirwad Old Age Home, Prem Niketan Ashram, and etc. Uh, the real sample for my whole thesis is 300, but for today's research paper, and actually it's my beginning of the research field work. So till now I have majorly interviewed 60 to 80 old age people. So I have written here, mentioned the 40 people's data. So I talked with 40 elderly people and mainly women. Then I also talked with 10 caregivers and the owners of the old age homes. And beside this, I also reviewed some articles, some media newspapers, the information about that. And also, beside this, I searched it on YouTube that what all information is present there. So while reviewing, I saw many blogs. Many bloggers are going in the old age homes and they are covering their stories. And also various ad companies even the food chains like Domino's, they are they are giving some example by showcasing ads. For example, on the occasion of Mother's Day, they started a campaign with the hashtag "माँ नहीं भूलती." In this hashtag, they created a ad. इसमें उन्होंने दिखाया कि एक बेटा होता है, अपनी मदर को वो ओल्ड एज होम में छोड़ के आता है, कह के कि अब हम इतना बिजी रहते हैं हमारे स्केड्यूल में, डेली लाइफ में, तो हम आपकी केयर नहीं कर पाएंगे, तो इसलिए आप यहाँ पे रहिए। ठीक है, वो जिस भी मजबूरी से या जिस भी से वो वहाँ पे रहने लगती है। फिर वो वहाँ पे डेली अपने ओनर से, अपने केयर गिवर से पूछती है कि क्या मेरे बेटे का कॉल आया, क्या मेरे घर से कोई मुझसे मिलने आया था, या जब मैं कुछ सो रही हूँ या कुछ भी ऐसा वो पूछती है। तो उनका हमेशा रिप्लाई रहता है कि नहीं, अभी तक माता जी किसी का भी कुछ भी कॉल नहीं आया है। ठीक है, फिर वहाँ पे क्या होता है कि ओल्ड एज होम्स में मैंने भी देखा है अपनी फील्ड स्टडी में, एंड प्लस इस एड में भी दिखाया गया है कि कैसे उनके लिए जनरेट करते हैं फॉर विमेन, टेलरिंग के लिए वो व्यवस्था करते हैं। जिन लोगों को आर्ट एंड क्राफ्ट में शौक है, पॉटरी में है, सिंगिंग में है, उनके लिए व्यवस्था करते हैं वहाँ पे। तो उस एड में भी शोकेस किया है कि वो लेडी एज अ टेलर वहाँ पे काम करने लगती है, तो उनको इन रिटर्न कुछ कैश भी मिलता है। तो उस दौरान वो लेडी को याद आता है कि मेरे बेटे को ये खाने में पसंद था। फॉर एग्जाम्पल, उसमें डोमिनोज का पिज्जा दिखाया गया है कि मेरे बेटे को स्पेसिफिक ये पिज्जा पसंद था। अब उसने जो वो अर्न किया मनी, तो उससे उसने स्पेशली एड्रेस पे वो ऑर्डर करवाया कि मेरे बेटे को दीजिए। तो वो ये चीज देख के बेटा वापस आता है, उसको इतना रियलाइज होता है, इतना दुख होता है कि मेरी मदर अभी भी मेरे लिए इतना ध्यान रखती है, सोचती है, मैंने इन्हें ओल्ड एज होम में रख दिया। सॉरी। तो ऐसे ही अलग अलग हैशटैग्स और डिजिटल कैंपेन्स चल रहे हैं इंडिया में ही। इसके बाद इन सारी स्टडीज के बाद हमने एक मॉडल तैयार करा है कि किस तरीके से मीडिया और हेल्प कर सकता है ओल्ड एज मैन एंड वुमेन को उनकी स्टोरीज को बाहर लाने में, ताकि उनके लिए अच्छे से गवर्नमेंट पॉलिसीज बना सके, लॉज बना सके। प्लस जो आजकल की अपनी यूथ है, जो अपनी जनरेशन है, वो भी वैल्यू समझे एल्डर पीपल की, कि उनसे अच्छा बॉन्ड बनाए, उनसे उनकी अच्छी केयर करे, उनको उन्होंने जैसे हमें पाला है।
Ma'am, if you could come on the conclusion part, please.
Yes, ma'am, this is the conclusion now, that yes, media strongly shapes how elderly women in old age homes are seen and treated, and these such campaigns also they play a very important role. Beside this, YouTube videos, blogs, and newspaper reports highlights both challenges and resilience in care homes. And when all these type of support, all this type of motivation is given to these women, older women, they feel very confident, and emotionally also they feel very well and happy. So I would like to conclude it by saying that aging should not be seen as a decline, but as a meaningful stage of life where both women and men continue to hold value, identify, and purpose. And these were the references of the articles and the social media campaigns. These were the articles published on the internet. Thank you. Any questions?
As of now, I would just like to ask that how will you justify? I mean, I couldn't understand the future implications and what you actually want from the policymakers. Or yeah.
मैम पहले तो हम था कि मीडिया को शोकेस ही नहीं करती थी कि जो रियलिटी में ओल्ड एज होम में कंडीशन है, चाहे इधर मैन हो या विमेन हो, पहले शोकेस ही नहीं होता था. पर ड्यू टू सम एडवांसमेंट, जैसे अब सोशल मीडिया भी आ गया है एंड बच्चों में भी आजकल काफी वापस से रिवाइव हो रही है फीलिंग्स, तो दे विजिट, वहां पे वो विजिट करते हैं, तो वहां पे वो खुद वहां पे जाके स्टोरीज वगैरह उनसे बात करते हैं, उनसे पूछते हैं कि आपका क्या रीजन रहा यहाँ पे रहने का. अब जो भी उनकी मजबूरी थी या वो वॉलेंट्री रह रहे हैं, इनवॉलेंट्री रह रहे हैं, जो भी रीजंस थे, चलिए ठीक है वो रह रहे हैं. अब हम चाह रहे हैं कि मीडिया के थ्रू ये हो कि वो सारी चीजें, मान लीजिए एक एग्जाम्पल था, नोएडा के कोई ओल्ड एज होम में था कि वहां पे लोग बाग एल्डरली पीपल वहां रह रहे थे, ठीक है, पर दिखा बहुत अच्छा रहा है कि हाँ कि बहुत अच्छा है, सब फैसिलिटीज है, बट इन रियलिटी इट वाज नॉट द सीन. उनको मतलब साफ कपड़े भी नहीं पहन पा रहे थे, खाना भी एक टाइम मिल रहा है, 2 टाइम मिल रहा है, एंड सेफ्टी का भी कुछ कंसर्न ही था. तो हम ये
that gives answer to my question. Thank you.
Okay. Thank you, ma'am.
Rahul Vesh. Do we have Rahul Vesh, sir? Kaustubh Vyas. Cyprian. Asam Anim. Dr. Dayanand Kedan.
Yes, madam.
Sir, you may present.
Good afternoon to everyone. Am I audible or visible? My presentation is visible.
Yes, sir, it is visible.
Yes, respected chair and audience, I would like to present the presentation Role of Media in Transforming Global World Study. I am Dr. Dayanand Kadyan from Sanskaram University, part of the Jhajjar, Haryana and India. I would present here to exchange the ideas and express the knowledge of role of media in transforming world. As we know that in 21st century has changed media from a one-way source of information into a highly interactive global system that connects people, cultures, markets, and governments. The growth of digital platforms, artificial intelligence, social media, and citizen journalism has made communication faster and more influential than ever before. My research question of the presentation are: what are the nature and functions of the media in a globalized world? What is the impact of digital and social media? What are the challenges of the media in the transformation world? Keywords of the studies are global media, digital transformation, AI in media, citizen journalism, misinformation, etc. Objective of my studies are to analyze the changing nature and functions of media in globalized world, to study the impact of digital and social media on governance, economic and society, to identify the challenges emerging from media transformation to provide interdisciplinary insight into how media shapes global narratives, to suggest strategy for developing responsible and inclusive media systems. Material and methods. The study uses a qualitative and interdisciplinary research design suitable for understanding the complex role of media in transforming global world. The focus is on not on statistical instrument but on interpreting trends and patterns and impacts across social, political, economic, and technical dimensions. Data sources. I reviewed many research peer research journal of communication, media culture and society, international journal of communication, institutional reports में यूनेस्को, WHO, वर्ल्ड इकोनॉमिक फोरम की रिपोर्ट देखी है, इंडियन रिसोर्सेज, मिनिस्ट्री ऑफ इंफॉर्मेशन एंड ब्रॉडकास्टिंग एंड नीति आयोग डिजिटल इंडिया डॉक्यूमेंट्स, बुक्स, mass communication theory of KLJ Kumar, media theory, globalization communication, and AI and society books are consulted. Case studies, social movements, Me Too, climate, COVID-19 communication, global elections, international conflicts, digital approach forum, Facebook, Twitter, YouTube, etc. Research methodology.
कंक्लूजन पर आ जाइए.
There are three major. My conclusion of the studies are in a rapidly transforming global world, media has evolved from a passive information distributor into an active force that shapes the political processes, economic growth, cultural exchange, and technological advancement. Its ability to connect societies in real time has strengthened democratic participation, improved governance, outreach, and created new platforms for education, entrepreneurship, and global awareness. Modern media has made communication more inclusive by giving voice to individuals, communities, and movements that were previously unheard. However, the same technology progress has introduced several challenges. The widespread circulation of misinformation, political manipulation, declining trust into the news sources, digital monopolies, and the growing influence of AI-based content raise critical concerns about transparency, ethics, and accountability. Digital inequality further limits access to credible information for large sections of society, widening socio-economic gaps. To ensure that media continues to function as a tool for social and democratic progress, several steps are essential. Ethical and responsible journalism must be prioritized, supported by strong fact-checking mechanism and transparent digital governance. Media literacy programs should empower citizens to evaluate information critically and safely. Clear regulation on AI, data, and privacy. Platform algorithms are necessary to build trust and to protect user rights. Ensuring equal access to digital tools and connectivity will help bridge the information divide and promote the inclusive development. In conclusion, the future of the global communication depends on builds a media ecosystem that is ethical, inclusive, transparent, and technologically responsible. Such a system will not only strengthen democracy but also cultural harmony, global cooperation, and suitable human development. And in future scope of the study are very limitless. It explores the cultural media and other sections of media which used in the improvement of the international societies. Thanking you for giving opportunity.
I don't think I have any question. If anybody is having, he or she is free to ask. Otherwise, we can move ahead.
I think, ma'am, we can move ahead. Joseph Kalu, Ojeku Joseph Kalu.
Yep.
Next presenter.
Hello, ma'am.
Yes, sir.
यस मैं डिस्कनेक्ट हो गया था. मैं डॉक्टर दयान कादर.
Sir, we don't have any questions for you.
Thank you, madam.
Joseph Kalu, next person.
Okay. Can you hear me? Yeah. Good morning. Yeah, I'm speaking on communicative misrepresentation and diagnostic errors, emerging challenges in Nigerian universities health behavior. Okay, my presentation today focuses on the violent or dangerous crimes in Nigerian universities, how communicative misrepresentation leads directly to diagnostic errors among students. Every day, thousands of students seek care in campus clinics. Many leave with wrong diagnosis, not because clinicians are incompetent, but because information is distorted at the point of communication. All right. So this particular study is purely, in my own finding, is purely new because we had no empirical literature to review apart from reported mentions in media of incidents that had happened among university students. So, plus national policies and conferences that came out of them. So that led me into this study. A particular student from a particular university, Aurora Faculty, went to his campus clinic and reported that she had heartburn. And then upon reaching there, the clinician took her up and then treated her for heartburn. But only a few hours later, she had a heart failure, a cardiac failure. So there are other reports like that that came up that really informed the study that we are having today, or that I went into. Okay. Nigerian university, the objective of the study, Nigerian universities constitute a unique population with increasing vulnerability to health challenges, shaped misinformation, digital media exposure, stigma, and limited access to advanced physical facilities. The research seeks to fill the gap by identifying communicative representation among students, understanding these distortions, providing solutions that integrate health communication into clinical practice, research methodology. A mixed method of descriptive design was employed to understand both the patterns and the lived experiences of communication-related diagnostic challenges, population and settings. The study focused on students and healthcare providers in selected Nigerian universities with functional campus health centers. Sampling technique. Quantitative stratified random sampling of students across faculties was employed. Qualitative strand, purposive sampling of medical and nursing staff in university clinics was employed. Data collection method, Structured questionnaires were administered to students to assess one, symptom reporting behavior, two, health seeking patterns, three, use of social media for medical information, four, perception of campus healthcare workers, data analysis. Quantitative data were analyzed using descriptive statistics, frequency distribution, and cross-correlation. Two, qualitative data were analyzed using thematic analysis, guided by concepts of health communication, patient-provider interaction, and dialectic reasoning. Then triangulation ensured the validity and reliability of findings. Health-seeking behavior among young, this is the background. Health-seeking behavior among young people has changed dramatically. Students today control Google, TikTok, PS.
Mr. Ujaipur, if you could conclude it soon, please.
Hello, ma'am.
Yeah, since we are running short of time, if you could come to the conclusion, we would be able to understand it.
I couldn't get you.
So could you please conclude your presentation? We are running short of time.
Okay. Thank you. So, in 2023, September, Nigerian University Commission came up with what we call the 60 band, which is the core curriculum minimum academic standard, to ask us to look at problems in our various universities to find out what will be added to enrich and solve the problem within our campuses. So for the Nigeria University, we had to adopt what we call health communication. So it is our creation in the whole of Nigerian universities. We are the only university that is presently teaching that. So we discovered that there is a very big chance, a gap, a disconnect that is existing between caregivers, between clinicians, and health seekers. So for that reason, we have been paying so much attention to what is actually happening in the health ecosystem. So that's what led to this research. Okay. Recommendation. A communication training for workers, campus clinicians in probing questions, active listening, cultural sensitivity, and recognizing communication gaps. Student health literacy campaigns.
Sir, kindly conclude your please conclude your lecture. We have only 3-4 minutes and all the guests are waiting for the valedictory.
Okay.
You just conclude in few seconds. Yeah.
Okay.
And we have two more paper presenters.
Okay.
Yeah, just
In
conclude.
conclusion, we discovered that if universities improve communication, they will save more lives than by burying new equipment. Then we also discovered that if every correct diagnosis begins with correct conversation, then we must fix the conversation. That is where we have to really end it. Thank you very much. Thank you.
Next presenter, Rahul Vesh.
Yeah, ma'am, sure. Yeah.
So try to present quickly.
Okay, okay. Mm. My PPT is visible, ma'am.
Mr. Rahul, just your topic, methodology, and conclusion.
Okay, ma'am. Okay, my topic is the social media and the representation and advocacy. And introduction is the key transformations, and the characteristics of shift that advocacy is now a dynamic and participative force, and the instruction of the accessibility of the demand and authentic representation and the strategic grassroots tools, and reclaiming beacon that description of the platform and provide the community with the tools authentically represent and the own experience. Example like TikTok and YouTube share the nonsense and the challenging misconception. And next heading is mobilization and action. The key point is Me Too and the Black Lives Matter. That's the global challenge social media issue, and the policy of the that democratize and they ensure that voice of the most affected and the directly hard of the policymakers. Challenge is glad 2025 social media safety index reveals that the companies are the activity rolling back and the safety policy, creating the less safe environment for the LGBTQ and the others marginalized group. So misinformation is present the problem required the advanced media and the literacy skills to verify the fact and credible sources. Conclusion is that summary is the social media uh, irresponsible responsibly alert the landscape and the representative and the advocacy. The future is that effective advocacy hints the strategic and the ethical of the digital tools, and the required is critical understanding of the both instance and the potential and the other inherent the challenge is like safety and the digital equity. Thank you, ma'am. Thank you.
All right, the next presenter.
Rama, कोई रह गया क्या Rama?
Yes,
वो
sir.
संजना माथुर है ना शायद, कौन है?
Shrija Mathur.
श्रीजा, उनसे भी कहिए 1 मिनट में करते हैं अपना प्रेजेंट और क्या?
Yes, Shrija Mathur. Kindly present.
Sorry to interrupt, but my name was not called today. Hello, ma'am.
Yes. Priyanka ma'am, kindly present quickly.
Sure. Thank you. I'm Jaya Priyanka, and I'm going to present today about what journalists perceive about the usage of AI in their day-to-day life. So, just a second, I'm just taking 1 second to just share my presentation. Is it visible? Can we see it?
Yes, it's visible.
Thank you. So, the newsrooms are actually using the AI as a tool for transcription, data analysis, summarization, and they are using it to as a tool to, especially the digital media is using it as a tool to enhance their content online. But still, it's not all green. It's not all okay because they do have confusions about various things. For example, they know that there are editorial agenda setting that the AI has, and there's always a human need that has to be there in between. And there is also inconsistency problem, and the robot also does not understand the human feelings when they're writing stories. So these are some of the worries that the journalists have while using AI. So transparency, is it a solution? Sometimes yes, sometimes no, because most of the journalists feel that it is not fine to just tell readers when you use AI for translation, because we're already using Google Translate in every single day. So transparency is not a solution, but what they're kind of looking for is some guidelines and some good practices as an example, um, that will tell them what is the right way to use, what's the wrong way to use. In newsrooms right now, people think that if a journalist is using AI, it's kind of a shameful thing. So there's no open talk about usage of AI. So journalists feel that more transparency and guidelines would help them do it better. So there's a summary of all the various review literatures, um, various articles that I have put together. What are the things where journalists appreciate is accelerating their routine tasks, helping them write the stories with a better analysis. But they do worry about the biases and, of course, public distrust issues. So, moving forward, the scope for future research would be to explore how journalists can participate in making those guidelines and use AI in a better way. So, that's all. I just ran through it really quick without a breath. Thank you.
All right, thank you. I hope with this we come to the end of all the presentations.
Please, you
Yeah.
need to present, please.
Rama, please.
I think
Rama, please.
Cyprian Afram is left.
Yes, please. Ma, can I present?
Yeah, please go ahead, but you have only 2 minutes.
Please, I will not take much of your time, please.
Ma'am, actually, I'm also left Suja Mathur.
Please, I'll just summarize. I'll
Madhur,
send you.
you can wait, let Afram present, then you can have it.
Okay, ma'am. Okay.
Hello, let me present, please. Thank you for the opportunity. I'll still send it to the appropriate quarters. Distinguished scholars, my topic is on the topic. My name first, Cyprian Afamani from Evangel University, Nigeria. The topic I'm focusing on today is Nigerian newspaper coverage of rural areas in this digital era, issues, challenges, and prospects. It is an analytic-based content analysis. It is analytic appraiser-based content analysis. Let me just give the summary. Just as earlier said, I'll still send the detailed work to the appropriate quarters for publication. My presentation is focusing on Nigerian newspaper coverage of rural areas in this digital era. What this means for the national development, democracy, and the media responsibility. The study begins with a simple observation. Nigerian population makes up large portion of the country, yet their realities, that things that matters to them, like agricultural deficit, infrastructure deficit, poverty, health challenges, security challenges, they are rarely mentioned in front pages of Nigerian newspapers. In this age where digital technology should make reporting easier, rural communities still remain underreported, underrepresented, and in many cases invisible. The objective of this study are to examine how newspapers portray rural issues, what frames they use for the rural, what frames they use, how much space rural stories receive in Nigerian newspapers, and how digital tools such as online platform, multimedia, and data journalism are being used to improve rural coverage. The theories used to anchor this research are